All right. So, copy that link. All right. So, my name is. Today, we're looking at the central nervous system. Okay. All right. So, give me a second, guys. Okay. Okay. So today we're going to look at the central nervous system, okay?
The great and mighty nervous system, or the brain as most of us call it. What makes this organ unique is that within it lies the ability for humans to know oneself. This feature distinguishes and sets the human species apart from the rest of creation. This ability is known as consciousness or intelligence. To begin, let's look at the primary function of the nervous system. The basic purpose is to coordinate all of the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. Now, the nervous system is actually split into two parts: the central nervous system and the peripheral nervous system. We'll explore the peripheral later, but first, let's look at the central nervous system. The central nervous system is made up of two major structures: the brain and the spinal cord. As most people know, the brain is found within the cranium or skull, and there are 6 main sections among other structures within it. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The first section is the cerebrum. This is the largest, responsible for certain reflex actions such as the pons is located below the midbrain, below the cerebrum, at the top of the brainstem. It is responsible for certain eye and auditory reflexes. Functions such as the cerebrum in the midbrain. This is the section located in the back of the head below the cerebrum. Here. And the central nervous system is made up of 2 major structures: the brain and the spinal cord. As most people know, the brain is found within the cranium or skull, and there are 6 main sections among other structures within it. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The first section is the cerebrum. This is the largest section. It's divided into two major hemispheres, which are the right and left hemisphere. And the cerebrum is further divided into four lobes. These four lobes are the frontal, the parietal, the temporal, and the occipital. The frontal lobe is primarily responsible for reasoning and thought. The parietal is primarily responsible for integrating sensory information. The temporal is primarily responsible for processing auditory information from the ears. And the occipital is primarily responsible for processing visual information from the eyes. The second section of the brain is the
So let me pause. What are the 6 areas of the brain?
I got 2. It is cerebrum, cerebellum, and
Okay. So what I want you to write these down. Okay. Have you written them?
yeah. Is it the 6?
Okay, you've written them?
Yeah, I've got them.
Okay.
The first section is the cerebrum. This is the largest section. It's divided into two major hemispheres, which are the right and left hemisphere. And the cerebrum is further divided into four lobes. These four lobes are the frontal, the parietal, the temporal, and the occipital.
Okay. I want you to write this down. Do you know what this area is called? What is this area called?
What you say, teacher?
This area, what do you think it's called?
Who's
Huh?
is it the cerebrum?
No. No, look, listen. I'm showing you 4 names, and I'm telling you, asking you, what do you, of these 4, 1, 2, 3, 4, this area, what do you think it's called?
The frontal.
Frontal, exactly. And here?
The which one? Where?
Here.
Okay, is the parietal?
No. Try again.
No. The parietal, the temporal. Is it temporal?
Temporal. Okay. And here, this is called the occipital. So this frontal, temporal, parietal, this area here to here is called the parietal. Okay. The top.
Okay.
Frontal, parietal,
The temporal.
temporal, and occipital.
Occipital. Okay.
Okay.
So I mean, where we got the yellow color, is that the back?
Yes, that's the occipital. Yes,
Okay.
this is the back. So this is the frontal. Okay.
Mm-hmm.
This is the that's frontal. As a parietal.
Parietal.
As a temporal, this one. This is temporal. Okay.
Mm-hmm.
And this is the temporal. Well, this is just telling us. And we already saw the parietal, right?
The parietal is primarily responsible for integrating. The frontal lobe is primarily responsible for reasoning and thought. The parietal is primarily responsible for integrating sensory information. The temporal is primarily responsible for processing auditory information from the ears. And the occipital is primarily responsible for processing visual information from the eyes.
So a way for you to remember it is the eyes are in front, but it's the back that controls the function of the eyes, seeing, even though the eyes are in front. Okay? So that's a way for you to remember it. And then hearing is close to the temple. And this is the area, the temporal, that conducts, issues by hearing. And here, your front is where your thinking is here, the frontal lobe. And then here is for sensation. Okay, that's just a way for you to remember it. Okay?
Is that the occipital? That he is the occipital?
No, this is the occipital. Back here, occipital. See it? The back.
The back is the occipital?
Yes.
How?
The middle here is parietal.
Oh, okay.
Okay.
Right.
So think about parent. Your parent is on top.
Okay.
This is your frontal.
Yes.
This is your temporal. Okay. So this is so even though the eyes are here, it is the back of the head that controls the eyes. Okay?
Okay.
The second section of the brain is the cerebellum. This is the section located in the back of the head, below the cerebrum, and above the first cervical.
Excuse me.
Yes?
I got a little bit confusion. Temporal is the top, right?
No, the top is
your parent. Parietal.
Is it temper?
No,
is it parent?
Parietal. Parietal.
Yeah.
Just like your parietal is on top.
Okay, the temporal is
near the top.
Okay.
Top. Okay. Temporal top. Okay.
Okay, thank you.
Okay. This is frontal.
Yeah.
And this is occiput.
Occipital.
Okay.
Okay, thank you.
And located just below the cerebellum, it is the cerebrum. Okay. Let's go back to this picture. So you see this the cerebrum. This is this one. Cerebellum is this cerebellum. Okay. All right.
Yeah.
It's all the way in the back here.
Yeah.
Noaku.
Yeah.
Just here. That's cerebellum. Below the occipital. Okay.
Okay.
So let's look at this picture again. This is the midbrain. All right. Cerebellum. diencephalon, this one. This is the midbrain. This is the pons. Pons. Medulla oblongata. Okay. Midbrain. No, sorry, diencephalon. Midbrain, pons, medulla oblongata. Cerebellum, cerebrum. Okay.
Ears. And the occipital is primarily responsible for processing visual information from the eyes. The second section of the brain is the cerebellum. This is the section located in the back of the head, below the cerebrum, and above the first cervical of the neck. It is responsible for muscle coordination, balance, posture, and muscle tone. The diencephalon section is found between the cerebrum and the midbrain. It contains two structures, thalamus and the hypothalamus. The thalamus behaves much like a relay station and directs sensory impulses to the cerebrum. And the hypothalamus controls and regulates autonomic nervous system functions such as temperature, appetite, water balance, sleep, and blood vessel constriction and dilation. The hypothalamus also plays a role in the emotions such as anger, fear, pleasure, pain, and affection. The midbrain section is located below the cerebrum at the top of the brainstem. It is responsible for certain eye and auditory reflexes. The pons is located below the midbrain and in the brainstem. It is responsible for certain reflex actions such as chewing, tasting, and saliva production. And the last section is the medulla oblongata. It's the lowest part of the brainstem, and it connects with the spinal cord and is responsible for regulating heart and blood vessel function, digestion, respiration, swallowing, coughing, sneezing, and blood pressure. It's also known as the center for respiration. Now that we've covered the brain, let's take a look at the other half of the central nervous system, the spinal cord. The spinal cord is the link between the brain and the nerves and the rest of the body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and the afferent and efferent spinal nerves, which merge to form the peripheral nerves. The afferent spinal nerves are responsible for carrying information from the body to the brain. And the efferent spinal nerves are responsible for carrying information from the brain to the body. Now, within this elaborate system of nerves, neurons, and dendrites, there is a system that regulates the functions of the central nervous system, which lie outside its major components, such as the brain and the spinal cord. This system is known as the peripheral nervous system and is subdivided into 2 smaller systems: the somatic system and the autonomic nervous system. The somatic nervous system is responsible for carrying motor and sensory information both to and from the central nervous system. This system is made up of nerves that connect to the skin, sensory organs, and all skeletal muscles. The somatic system is also responsible for nearly all voluntary muscle movements, as well as for processing sensory information that arrives via external stimuli, including hearing, touch, and sight. The structures that allow this communication to happen between the nerves throughout the body and the central nervous system are known as the afferent sensory neurons and the efferent motor neurons. Now, afferent simply means conducting inward, and efferent means conducting outward. So just like in the spinal nerves, afferent neurons take information from the nerves to the central nervous system, and the efferent neurons take information from the central nervous system to the muscle fibers throughout the body. The autonomic nervous system is further divided into the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system is vital to our survival. Have you ever heard of the fight or flight response to danger? The sympathetic nervous system revs up the body when confronted with imminent danger to either defend yourself or to escape the threat. The parasympathetic nervous system is the counterbalance to the sympathetic response to danger, whether real or imagined. Once the threat is gone, the parasympathetic brings all the systems of the body back to normal. Now, at this point, you should have a basic understanding of the nervous system, but let's do a quick recap. The basic purpose of the nervous system is to coordinate all the activities of the body. It enables the body to respond and adapt to changes that occur both inside and outside the body. The two major parts to the nervous system are the central nervous system and the peripheral nervous system. The central nervous system is also divided into two major structures, the brain and the spinal cord. The brain is found within the skull or cranium, and it is made up of 6 main sections. These 6 sections are the cerebrum, cerebellum, diencephalon, the midbrain, pons, and the medulla oblongata. The other half of the central nervous system is the spinal cord. And the spinal cord is the link between the brain and the nerves and the rest of your body. The spinal cord is divided into 4 different regions: the cervical, thoracic, lumbar, and afferent and efferent spinal nerves, which merge to form the peripheral nerves.
We'll give you that.
Now that we know the brain and spinal cord primarily make up the central nervous system, let's look at the peripheral nervous system. The peripheral nervous system is essentially the nervous system outside of the brain and spinal cord. The peripheral nervous system is then subdivided into 2 smaller systems called the somatic nervous system and the autonomic nervous system. So, as you can see, the nervous system is quite complex, and this is just the tip of the iceberg. Thanks for watching. Look for more videos on the nervous system at cteskills.com.
Okay. So that is our introduction to the nervous system. Let me share my screen again. Oh, were you hearing the sound?
Yes, I hear it.
Oh, okay. All right. I didn't share the sound. Let's see, where would I do here? Okay. So so the nervous system controls everything, right? Everything. Okay. Your brain controls everything. Okay. So like we said, the nervous system is made up of the brain, the spinal cord, and the peripheral nerves. Okay. And so this is the brain. So this is what the nervous system looks like. All right. It has 2 main divisions, the central nervous system and the peripheral nervous system. And the central nervous system, we have the brain and the spinal cord. And you know that the brain is divided into 6 areas, right? Cerebrum, cerebellum. They just mentioned the brain symbol. We know that you have the diencephalon, you have the midbrain. Okay, and they all have different functions. Okay, so this is like we said, this is the central nervous system, and this is the peripheral nervous system. And the peripheral nervous system is further subdivided into two areas, 2 parts: somatic, okay, and the autonomic. Okay. The somatic controls voluntary movements like walking, talking, okay. And the autonomic manages involuntary functions like your heart rate, your digestion. And this autonomic is further subdivided into sympathetic and parasympathetic. Okay. All right. So once again, central nervous system, brain, spinal cord, peripheral nervous system. You have the, cranial nerves. That's the nerves that come from the brain, and the spinal nerves, the nerves that come out from the spinal cord. Okay. And so this peripheral is divided into sensory, and motor. And for the motor fibers, you have divided into somatic, and autonomic, and the autonomic is further divided into sympathetic and parasympathetic. Okay. Now, so when we talk about the that our body is made up of, have we done cells? Stanley, let's not do this. If you're feeling sleepy, just stand. Okay, I'm standing. So if you're feeling sleepy, just stand. All right, I am standing. Okay. Yeah. Yeah. So I'm standing myself. All right. So now we've done cells, tissue, organs. Have we done that our whole body is made up of cells? Have we done that?
No.
But do you know that our body is made up of cells?
Yeah.
Okay. So the cells that make up the nervous system are called neurons. Okay?
Yes.
Okay.
Okay. So the cells that make up the nervous system are called neurons. Okay? Let's see what this one is. Copy hyperlink. Let's see what that hyperlink is.
Welcome to 2-Minute Neuroscience, where I simply Welcome to 2-Minute Neuroscience, where I simplistically explain neuroscience topics in 2 minutes or less. In this installment, I will discuss the neuron. This is a brain. Estimates vary, but right now the best guess seems to be that our brains contain around 85 billion neurons. The neuron is a nerve cell, and it's the primary functional unit of the nervous system. This is a generic image of a neuron. Neurons actually come in all shapes and sizes, but this is the prototypical version of a neuron that you'll often see in a textbook. The structures extending from the left side of the neuron that look a little bit like tree branches are called dendrites. Dendrites are the area where neurons receive most of their information. There are receptors on dendrites that are designed to pick up signals from other neurons that come in the form of chemicals called neurotransmitters. Those signals picked up by dendrites cause electrical changes in a neuron that are interpreted in an area called the soma, or the cell body. The soma contains the nucleus, which contains the DNA or genetic material of the cell. The soma takes all the information from the dendrites and puts it together in an area called the axon hillock. If the signal coming from the dendrites is strong enough, then a signal is sent to the next part of the neuron, which is called the axon. At this point, the signal is called an action potential. The action potential travels down the axon, which is covered with myelin, an insulatory material that helps to prevent the signal from degrading. The last step for the action potential is the axon terminals, also known as synaptic buttons. When the signal reaches the axon terminals, it can cause the release of neurotransmitter. These purple structures represent the dendrites of another neuron. When a neurotransmitter is released from axon terminals, it interacts with the receptors on the dendrites of the next neuron, and then the process repeats with the next neuron.
Was I sharing my screen?
Yeah.
Welcome to 2-Minute Neuroscience, where I simply...
Okay. All right. Okay. So the cells, so the so when we talk about the, let me share my screen again. So when we talk about, when we say the brain, right, it is made up of these neurons, okay? They said that, how many billion? They said some, I don't know how many billion neurons. They said that. Sorry?
85.
Okay. Okay, the 5 billion neurons. Okay, so this is generally what they look like. Okay, you have the dendrites, you have the cell body or soma, you have the axon hillock, you have the axon, and then you have the I don't know, can't remember what the structures are called. 6 terminal buttons. Okay, 4 is axon. Okay, so this is what exactly so if you pack 85 billion of these cells, these specialized cells together, that's when you now see. So everything you see, all of these things are made up of these, all of this that you see. Okay, everything you see, are made up of these cells. One after the other, one, just like that.
Yeah.
One connects to the next, and connects to the next, connects to the next. So that's how the nervous system is made up. Okay. Let's see. Let's see this one.
Human anatomy. Neuron. The nervous system is an essential part of the human body that helps the transmission of signals across the various parts of the body, or it releases messages back and forth from the brain to the different parts of the body and also helps in the coordination of voluntary and involuntary actions of the body. At the cellular level, the nervous system consists of a special type of cell called the neuron, also known as the nerve cell. The neurons connect to each other using a synapse, which is a structure that acts like a pathway connection that transmits signals to other cells to form the nervous system. Neurons have special structures that allow them to send signals rapidly and precisely to other cells by providing a common pathway for the passage of these electrochemical nerve impulses. Neurons are responsive in nature, by which we imply that the neurons respond to feelings and communicate the presence of that feeling to the central nervous system, which in turn is processed and sent to the other parts of the body for action. The neurons are the basic constituents of the brain, vertebral spinal cord, the ventral nerve cord, and the peripheral ganglia, which is a mass of nerve cell bodies. Neurons can be categorized into 3 types: sensory neurons, motor neurons, and interneurons. Sensory neurons allow us to receive information from the outside world through our senses. The sensory neurons evoke the sensation of touch, pain, vision, hearing, and taste. These are usually present in the sensory organs like the eyes, inner ear, and so on, which send the signals to the spinal cord and the brain. Interneurons communicate and connect with each other and represent the majority of neurons in our brain. They allow us to think, see, and perceive our surroundings. Motor neurons are neurons that receive impulses from the spinal cord or the brain and send them from the muscles, causing muscular contraction, and these also affect the gland secretion. A typical neuron has a soma in its center, which contains the nucleus of the cell, and hence this is where the protein synthesis occurs. The neural function is based on the synaptic signaling, the pathway that helps in the transmission of signals, process, which is partly electrical and partly chemical. The electrical aspect depends on the property of the neuron's membrane. Every neuron is surrounded by a plasma membrane, which is a bilayer of lipid molecules that are comprised of various protein structures. A lipid bilayer is a powerful electrical insulator, but in neurons, many protein structures embedded in the membrane are electrically active. Cell division cannot take place in neurons as they lack one of the two cylindrical cellular structures that aid in cell division. This is consistent with the simple cell division nature of the cell. Dendrites are the extensions of the cell with many branches, whose structures can be called as a dendritic tree. They protect from the cell body and are sometimes referred to as fibers. They are also called as afferent processes because they transmit impulses to the neuron cell body. There is only one axon that projects from each cell body, which is a finer cable-like projector. It is usually elongated and carries impulses away from the cell body, that is, away from the soma. It is called a efferent process. Many axons are surrounded by a segmented white fatty substance called myelin sheaths.
Okay. So that is what a neuron is. Okay. Oh, I don't have to stop share. Let me stop share.
The one that, he talks about three neurons. The sensitive neurons is the one like if I hurt myself, that's the one that give the signal with my brain.
Mhm.
Okay. Alright.
And then the interneurons are in the brain. So if you hurt yourself, the sensory neuron perceives that pain.
Okay.
Then it takes that, okay, from your hand to the brain.
Mhm.
Then the brain senses it through the interneurons and gives information back to the muscle
Mm-hmm.
to contract and move your arm.
Okay.
Okay, so it goes first to the brain, then it's interpreted there, and then back out.
Okay.
Mhm. Let me still share my screen 2. Okay, so this is again the neuron. All right, there are different types of, they don't all look the same. Okay.
In total, we have 85 neurons in our body.
85 billion.
85 billion
Billion
Billion.
in the brain,
in the
which means there's more. Okay.
Okay.
So this in neuron, the neuron is what makes up the nervous system. Okay.
Okay.
Right.
But the 85 billion that we have, it is for men and women.
Yes, same.
Okay.
Same. Okay, and this is so the impulse, it's kind of like the way electricity goes through a wire. Yeah. Yes.
Say again.
The way electricity, it's actually electricity, goes
Mhm.
through, that's the same thing. The electricity comes in here and goes through and then goes out there and then it goes to the next cell. Okay.
Oh,
Mhm.
All right. So let's look at common diseases of the nervous system. We have what you call degenerative diseases, okay, like Alzheimer's, Parkinson's disease, multiple sclerosis. We've all heard of Alzheimer's, right? Yes?
Yes.
It's
Okay.
all those Alzheimer.
Sorry?
You said it's all those Alzheimer.
Have you all heard of Alzheimer's?
Yes.
Have you heard of it?
Yeah.
Yes.
yeah.
Okay. All right. So let me show you what Parkinson's disease looks like. You may not be very familiar with Parkinson's disease, but I'll show you what it looks like. I don't want the one that is too long, I want the short one. Well, let's try this one.
When I was younger, I was great at printing, like an architect. Over time, it was becoming harder and harder. Then it got to the computer mouse, and typing. I used to type about 180 words a minute, and it just got worse and worse. And I was always very organized, and I was very thorough and detailed. And it changed. Who I was as a person was changing. And I knew that there was something wrong.
Parkinson's disease is a clinical diagnosis, so there's really no absolute test that absolutely defines it. It's not like diabetes where we have a blood test, or like a stroke where we can just take a picture of the brain. It's really a clinical diagnosis, which means that we listen to the signs and symptoms that are described by the patient. We also do a physical exam. The classic symptoms that we teach our medical students about, they actually spell the word TRAP, T-R-A-P. T stands for tremor, so the tremor is usually a one-sided tremor in one hand or one leg, and it's usually at rest. R stands for rigidity, which means that patients have increased tone that we can measure on the exam. A stands for akinesia, or lack of movement, and patients will complain of slowness, that they've slowed down. And then P stands for postural instability, and that can be a later finding, usually in classic Parkinson's disease, where patients will have falls, they'll have balance issues, and they'll start to sort of lose their balance while they're walking.
Well, first it happens once in a while. With the hand motion and the shaking, that became a standard. But the writing, the organization, and the little confusion and getting fuzzy about things, it was intermittent. I figured everybody has that.
We're really trying to start off on the right foot, so it's really important to emphasize things like sleep. So getting a good night's sleep every night, we try to emphasize about 8 hours at the very least, if possible. Not napping in the day. Additionally, we think that exercise is very key. We're not talking about an overnight change from being sedentary to running a marathon, but setting goals and trying to keep within those goals is very important. And then eating well, keeping otherwise healthy. We really emphasize the fact that patients live near normal lifespans with this disease, so we want to keep all the other body systems working, keep our stroke risk down, cardiac risk factors down, so eating right and being healthy. It's absolutely important to get.
Anyway, so anyways, Parkinson's you see the way his hand was shaking, right?
Yeah.
And then yeah, anyway, I don't want to waste too much time, but It's tremor, tremor, rigidity, difficulty moving, and P. What's the P? Trapped. P was I think position. Let's see, what was P? Anyway.
Signs that it's not like diabetes where we have a blood test, or like a stroke where we can just take a picture of the brain. It's really a clinical diagnosis, which means that we listen to the signs and symptoms. The classic symptoms that we teach are, they actually spell the word TRAP, T-R-A-P. T stands for tremor, so the tremor is usually a one-sided tremor in one hand or one leg, and it's usually at rest. R stands for rigidity, which means that patients have increased tone that we can measure on the exam. A stands for akinesia, or lack of movement, and patients will complain of slowness, that they've slowed down. And then P stands for postural instability, and that can be a later finding, usually in classic.
Okay, so that's okay. So let's continue. That's Parkinson's disease. So we talked about degenerative diseases. Then there's, of course, infection, like meningitis, encephalitis. So itis means kind of like infection or inflammation when you say itis. Then there's vascular diseases like stroke, okay, stroke. And then there's neoplasms like tumors, okay. And then there's other conditions like epilepsy, increased myocarditis, migraine, and other things, okay. So signs and symptoms, we remember the other guy was tremor, rigidity, difficult akinesia, which means no, poor movement, and then postural instability. Okay, so you can have things like numbness, okay, numbness, engourdissement, okay. Tingling, picotement, douleur, okay, vision changes, hearing loss, faiblesse dans membre, paralysie, tremor, and then other things. The memory loss, difficulty thinking and concentrating, confusion, language problems, and things like headaches, dizziness. Okay, and so if a patient has remember what they do anyway. When you go to the doctor, they do blood tests, then blood tests for infection and things like that, and then there is cerebrospinal fluid analysis. Let me tell you what that is. Cerebrospinal fluid analysis. Let's go back to our here. Let's see what that is. Let me explain what that is. Okay, let's look at this. That's anesthesie locale. Okay. Anesthesie locale. Okay. To prevent pain. Okay, so they're going to put a needle. Okay, that is fluid from the spine. So in this case, they are measuring the pressure in the pressure in the Stanley, are you awake?
Yes.
Okay. So anyway, that's the pressure. Okay, they were measuring the pressure. Okay. So there is let's explain that a bit. Okay, let's look at this.
Hi, I'm Dr. Rana Kapadia, and I just want to tell you what to expect for your upcoming lumbar puncture appointment. As you may know, the brain is connected to a spinal cord, and these structures are surrounded by a sac. You've probably heard about this sac before. It's called the meninges. It's made up of several layers. You may have heard of children and adults getting meningitis. That's inflammation and infection of the sac that lines the spinal cord and brain. And often we do this procedure to look for infection in meningitis. Within the sac, it's a bit of a closed system, and there's fluid within it called the cerebral spinal fluid. We abbreviate that CSF. That's what we're going to measure the pressure within today, and also we're going to take a sample of that fluid. The spinal fluid, the CSF, is made by the brain, and it's absorbed into the venous structures of the brain and back into the body. And so some patients can have high pressure problems from too much production of spinal fluid, or perhaps an obstruction in the absorption of the spinal fluid. Other patients can have low pressure in the spinal fluid from tears in the sac, whereby there's leakage of the fluid. But the main reason we often do lumbar punctures is to look for clues if someone has infection or inflammation of the brain and spine. Because the brain and spine are constantly bathed and surrounded by this fluid, there's a lot of things we can test for. The mechanics of getting the fluid sample is by doing the lumbar puncture, which is putting a small needle into the lower back and into the lower part of the sac, pretty much where the sac terminates at the bottom of the canal. It's important to know that where we put the needle is well below the spinal cord. In most patients, the spinal cord ends at about L1, L2, and typical areas where we would get the sample is at the level of L3, L4, or L4 and L5. That's important because the word spinal tap and lumbar puncture often conjures up scary images of punctures into the spinal cord, but that's not the case. And in fact, we want to go where the sac terminates. That being said, there are nerve roots destined for the legs that go through that sac, and sometimes when we enter the sac, there can be a brief pins and needles on either the right or the left side, but that's often transient. So the mechanics of doing the lumbar puncture is that it first requires you to change into a gown so that your back is exposed. Then we'll position you in either one of two positions. You can be laying on your left side in a cannonball kind of tuck position, or you can be sitting upright and flexed forward. The position will be dependent on whether we need to get a pressure measurement and also due to your comfort. After we've positioned you, we'll examine your back to try to understand the best place to put the needle and get the sample. Once we've determined that, we'll make a small marking on your back with a marker to help us understand where we're going to get the sample. After that, we'll clean the skin with an antiseptic solution. We'll put in a little bit of freezing, just like the kind you'd get the dentist to freeze the skin and the softer tissues, and then we'll give that some time to take effect. That part stings a little bit, but that should be the most painful part of the procedure. After that, most people notice pressure. They know that something's happening, but it shouldn't be painful. This is not meant to be an overly painful procedure. Once the freezing's in, we use a longer but much tinier needle to get that sample through the sac. After, we have you lay in the clinic for 5 or 10 minutes to rest, and then you're free to get changed and go home. There are risks to having this procedure done that you should know about. First and foremost, there is a risk of having...
Okay, so let's
Welcome to the Stanford Healthcare Emergency Department. Our goal is to provide you with the highest quality, most compassionate care possible. There are many reasons to perform this procedure, including severe headache, neck stiffness, fever, and concern for brain or spinal cord injury. The goal of this procedure is to collect cerebrospinal fluid, the fluid that surrounds your brain and spinal column, for testing. A needle will be inserted carefully into the spinal canal in your lower back in order to do so. This is a relatively common procedure, performed about 400,000 times per year in the U.S. Test results from this procedure will help determine how to treat you further. The procedure takes approximately 30 minutes, including setup, and laboratory testing usually takes 2 hours. Your doctor will instruct you to either lie on your side or sit up on the edge of the bed in preparation for the procedure. The doctor will then direct you to arch your back like a cat and hold this position for the duration of procedure. Maintaining the correct position minimizes pain and greatly increases the procedure's chance of success. So it is very important that you understand the correct positioning and ask your doctor or nurse to check that your back is arched properly. After positioning, the doctor will wash your back with a powerful soap. Then, a numbing medication will be injected into the skin. After the skin is numb, a needle will be gently inserted into your back to collect spinal fluid. This fluid flows slowly through the needle, so it can take up to 10 minutes to collect enough fluid. Typically, there is not a significant amount of pain associated with this procedure, though you may experience some pressure and discomfort. The most common risks of this procedure are similar to the risks of any needle insertion.
Okay, so you get it?
Mm-hmm.
Okay, that's CSF, okay, cerebrospinal fluid. So it's made in the brain, and then it goes down to the spinal cord. It just keeps circulating, okay? Other tests, you do X-rays, CT scan, MRI. You heard of all these things, right? X-ray, CT scan, MRI. You've heard of that?
I didn't hear about the CT scan, but MRI, X-ray, I know that.
Okay. EEG. I will show you what EEG is, and then angiogram. Let me show you what. Let me show you CT scan.
A CT, also commonly known as a CAT scan, the best way to describe it is it's a rotating X-ray machine. So an X-ray will take one picture, a CT will take a bunch of pictures while it rotates around you. You'll see your body in a full 3D plane on the images. A CT will be used for anything with the vascular or GI, so your heart system or like your bowels and stuff. I would say about 80% of our studies that we do, we use IV contrast. There are some exams we have where we have you drink contrast. The oral contrast will highlight anything within the GI, the belly system, and then the IV contrast will highlight stuff within the vascular system. Once a patient has checked into the registration, the technologist would come and get them, put them in a prep bay. We'd go through a screening form, we may take a blood pressure, some vitals, then we would start an IV if we needed to. We would bring you back into the room and have you lay down on the table, make sure you're as comfortable as you can be. For most exams, we do allow you to wear your own clothes. For patients who are wearing an underwire bra, we may ask you to slip that off because that metal can create a little bit of artifact on our images. CT exams, typically you're on the table for about 5 minutes. Actively scanning for less than that, most of that is just the prep and the setup. We'll send our images off to a radiologist. Radiologist will look at it and develop a report. The report will get sent both to your ordering doctor and to your MyChart so you can take a look at it as well.
Okay, so you know what a CT scan is now?
Yes.
All right.
I don't like it.
Sorry?
I say a lot of people don't like it.
Okay.
The Haitian people, they say, "Oh, I'm not gonna go in there."
Now that's usually the MRI. The MRI takes a long time.
Yeah.
Okay. So let's do angiogram. Stanley.
Yeah.
Hola.
Loud.
Okay. All right. So what is an angiogram? Let's look at this one.
Your physician will watch the movement of the catheter on the fluoroscope. A coronary angiography, or cardiac catheterization, is an X-ray examination of the vessels and chambers of the heart, often done to identify any narrowed or clogged coronary arteries that are preventing blood from reaching the heart muscle. The study can also be used to measure the size and function of the chambers of the heart and the function of the heart valves.
I
When
don't know
you
if it's
arrive at the
just
hospital,
false to
an
me, but
intravenous line will be started.
there's
You
no
will
sound.
Oh, really?
Yeah. I don't.
Okay. All right, let me stop share and start to share again. Okay. It says share sound, but let's see. All right, as a matter of fact, let's not do this one now. Let's try another one. Let's do this one.
An angiogram is a minimally invasive.
Can you hear this?
Yeah, there is.
An angiogram is a minimally invasive image-guided exam that creates detailed images of blood vessels. It typically uses contrast that is injected through an IV. Contrast helps us see the blood vessels more clearly.
A radiologist uses imaging technology to place a thin, flexible tube called a catheter directly into a blood vessel to inject the contrast. We then use imaging to take pictures that track where the contrast flows through the blood vessels. An angiogram helps diagnose problems with blood vessels such as narrowing or blockages. It also guides procedures such as stenting to treat blood vessel disorders and CERT to treat liver cancers.
All right, let's...
This animation is brought to you by Skillshare, an online learning community with thousands of inspiring classes for creative people. Explore new skills, deepen existing passions, and get lost in creativity.
A coronary angioplasty procedure is also known as percutaneous coronary intervention. The procedure is done on blood vessels called coronary arteries. They supply your heart muscle with oxygen. The goal is to restore blood flow if a substance called plaque has significantly narrowed these vessels. To begin the procedure, the doctor will numb the skin in your groin. A needle will be placed through your skin and into the femoral artery. Next, a flexible guide wire will be passed through the needle into your artery. Then, the needle will be withdrawn. It will be exchanged for a small, flexible tube called a sheath. This permits access into your artery. You may feel pressure when the doctor inserts the sheath, but you will not feel it moving inside your artery. Next, the guide wire will be advanced up to your heart. A flexible tube, called a catheter, will be advanced over the wire to your coronary arteries. The progress of the procedure will be checked with an X-ray device called a fluoroscope. At this point, your doctor will remove the guide wire. Then, the doctor will move the tip of the catheter just inside the coronary artery to be examined. A special dye will be injected into the artery. This allows your doctor to view it better with the fluoroscope. The dye will make any blockages in the artery stand out. If a significant blockage is found, your doctor will insert a guide wire into the artery. A balloon on the tip of the catheter will be moved along the wire to the blockage. When the balloon inflates, it will expand the artery and improve the blood flow. You may feel some chest discomfort while this is happening. After this, your doctor will deflate and remove the balloon. A wire mesh tube, called a stent, may be placed in the treated area. The stent helps keep the coronary artery open. Your doctor will choose the proper size stent, which is compressed over a balloon. The stent will be moved into the artery over the same guide wire. When the balloon is inflated, the stent will expand and lock into place. After the balloon catheter is taken out, the stent will stay in place to hold the artery open. At the end of the procedure, the guide wire will be removed. To find out more about coronary artery angioplasty, talk to your healthcare provider.
Okay, so angiogram. So this was angioplasty. That is to repair. Plasty means repair. But even though that's not exactly what we were looking for, but generally an angiogram. Let's look at an angiogram. Let me see if this one will. Let's see, 2.1K views 1 month ago, British Heart. Okay, let's try this one.
An angiogram, or cardiac catheterization, is a test that looks at the blood supply to your heart. It can see if you have any narrowing or blockages in the arteries that carry blood to your heart. It's normal to feel nervous, but having an angiogram shouldn't hurt. It takes about 30 minutes, and you'll be awake. You'll be given local anaesthetic to numb the area. This may feel uncomfortable, but you shouldn't feel any pain. The healthcare professional will make a small cut in your wrist or groin, and a thin, flexible tube called a catheter will be put in your artery. The tube will be guided through the artery to your heart. A special dye called contrast dye is injected into the tube. This shows your blood vessels and any narrowed or blocked areas. You might feel a hot, flushing sensation when the dye is injected, or feel like you need the toilet. This is normal and only lasts a few seconds. X-rays will be taken so your healthcare professional can review the results after the test. The catheter will be removed and pressure put on the area to stop any bleeding.
All right, let's try this one.
What is a diagnostic cerebral angiogram? A diagnostic cerebral angiogram is a medical procedure that helps specialized doctors examine the blood vessels in the head and neck, including the brain. These doctors are able to examine blood vessels using high-tech imaging equipment to take X-ray pictures. What to expect during your angiogram?
The procedure will take place in a room like this, called the neuroangiography suite. It was designed specifically to perform procedures like yours. You'll lie down here with plenty of cushioning to keep you comfortable while the procedure is done. Your procedure will be performed under sedation. This means that your nurse will give you a combination of medications that will help you relax and remove any uncomfortable sensations.
In addition to the sedation medications, the doctor will also apply numbing medicine to your groin to ease any discomfort in that area. A small tube called a catheter will then be inserted into an artery in your leg called the femoral artery. You may feel some pressure as the catheter is being placed. The femoral artery gives the doctor a direct pathway to the vessels of the head and neck without crossing or coming close to the heart. How is a cerebral angiogram performed? The imaging equipment in the neuroangiography suite uses X-rays to help the doctors guide the catheter to the vessel they want to see. When it is time to take the X-ray pictures of the blood vessels, a contrast medium, or dye, is injected into the vessel through the catheter. This typically produces a warm but not painful feeling that lasts for a few seconds. The imaging equipment may rotate around your head. You may also hear beeping noises as the pictures are taken. These noises help to signal your doctor about the position of the equipment. The X-ray pictures are displayed on screens that the doctors watch as they are performing the procedure. The doctor will look at the pictures more closely once your procedure is finished. What happens after the procedure? At the end of the procedure, the catheter is removed and a closure device is used to seal the site. In selected situations, the doctor holds pressure at that site for 15 to 20 minutes. A Band-Aid is then applied. You will stay here in the recovery room for 5 to 6 hours after the procedure.
Thank you very much for watching. Again, please don't hesitate to share any questions or concerns you have with us. We hope your experience at Johns Hopkins is as pleasant and comfortable as possible.
Okay, that is all right. So that's we're talking about. We talked about CAT scan. We talked about angiogram. Let's look at what an EEG is. Is that somebody's phone? Could you put your phone on silent, please? Okay, so this is an EEG. Let's look at this. Let's see one with sound. Try this one.
Welcome to the St. Elizabeth Neurology and EEG Testing Center. Today, we'll guide you through the process of an EEG test. An EEG is a painless, non-invasive test that checks the electrical activity of your brain. When you enter the center, check in at our front desk and our friendly staff will guide you through the process. When receiving an EEG test, make sure to remember some rules. You can eat before the test, but no caffeine on the day of the test. You can take your prescribed medications as directed by your physician. When it is time for your test, a technician will take you back and first measure your head and mark where to place the electrodes. An array of 25 electrodes will be attached to your head with a light water-soluble paste, sending electrical signals from your brain to a recording machine. The test will last for about 30 to 60 minutes, and you may be asked to do some tasks during the test. Once the test is completed, you will be able to wash your hair, removing the paste. Any residual paste should come out with shampoo. After your test, you will most likely receive your results around 3 days after testing. Please reach out to your provider if you have any further questions on what to expect during and.
Okay, so you know what an EEG is now?
Yeah, but I need to know what kind of problem you're gonna have to do that EEG test.
Crise myocardique, par exemple.
Oh, okay.
Oh, okay.
Yeah.
When you do the EEG test, you just control the brain, right?
No. You are not doing anything. You just like it's a study to see what's happening in your brain. You are not doing anything. You are just lying down. It's a measure. You are measuring your brain. Just like if you are measuring your blood pressure, they're just measuring your blood pressure. You are not doing your blood pressure.
Okay.
Okay. They're just measuring. It's like if I want to measure your height, I'm just measuring your height. Your height is your height. Your weight is your weight.
Mm-hmm.
Okay. Your blood pressure is your blood pressure. Okay. Let's look at this.
An electroencephalogram, or EEG, is a recording of brain activity. During the test, small electrodes are attached to the scalp to pick up electrical signals from the brain. These signals show up as wavy lines on an EEG recording. This procedure is usually carried out by a highly trained specialist called a clinical neurophysiologist. An electroencephalogram can be used to help diagnose and monitor several conditions affecting the brain. The main use of an electroencephalogram is for the diagnosis and monitoring of epilepsy, a condition characterized by recurrent seizures. Some other indications of an electroencephalogram include the following: to assess the degree of encephalopathy in patients with altered mental status, syncope or loss of consciousness, to induce therapeutic coma in comatose patients in the ICU, for the prognostication of a cardiac arrest, memory problems, and dementia, during anesthetic procedures to monitor the depth of anesthesia, and to assess the brain function in patients diagnosed with chronic brain disorders such as multiple sclerosis, brain tumors, and in patients with head injuries. No patient preparation is needed before the test, and fasting is not required to undergo an.
So, you know, like when somebody has had a heart attack or a stroke, right? You know, sometimes the doctors will say the patient is brain dead. You know that they will say it's brain dead. There's no more brain activity. It's through an EEG that you know that.
Okay.
Okay, and then they will say, they'll call the family. They'll say your family member, they're brain dead. There's no more brain activity. They're just being kept alive with a machine. Would you allow us to turn off the machine? Okay.
Okay.
Yeah. So it's with EEG that they can say this patient is brain dead. There's no brain activity. Okay.
Sorry.
So that's what an EEG is.
That's been that people is pass away, right?
The patient, you said the patient is brain dead. The brain is not alive. The brain is dead.
So yeah. So when the brain is dead, that means the patient is passed away.
Well, I mean, it may, yes, kind of, but you can still keep them alive. You know, we're using a machine to breathe for them. But so usually usually it's a meeting. They call the family together and say, "Look, this is your family member. They're brain dead. They're just being kept alive with a machine. Would you allow us to turn off the machine because the patient is just there, but they're not really alive."
Okay.
Yeah. So that's what an EEG is. Okay. And treatments, you know, if the patient has convulsion, you give them anticonvulsants. If they have depression, you give them antidepressants. Pain, you give pain reliever. Okay. And then there's surgery and things like that. Okay. So that's the nervous system. All right. Okay. Let's take our 10 minutes and we'll be back. I know we're just doing 2 hours, but I need a break. So let's take our 10 minutes. We'll come back and we'll do one other system. Okay. At least we'll start it, even though we'll not finish. Or maybe we'll do a 5-minute break. Let's do a 5-minute break.
Okay.
Yeah.
attend the school.
Okay, I'm back. Okay, so we're going to look at the endocrine system. The reason why I have us do the nervous system and endocrine system together is because these two systems control the whole body. Okay? They are similar in that they control the whole body. Okay?
Mm-hmm.
The difference between them is that the control of they work together. The nervous system, the control is fast. Okay?
Mm-hmm.
You put your hands on something hot, you feel it, you remove your hand immediately. It's fast. The endocrine system control is slow. For example, it is the endocrine system that controls your growth. Okay? But you know that growth doesn't occur fast.
Yeah, that's big time.
Yeah, it takes time. So these two systems control the whole body. One does fast control, the other one does slow control. One mostly uses electrical impulses. The other one mostly uses chemicals. And these chemicals are called hormones. Okay? All right. How many of us have heard of diabetes?
Sit down.
How many who has heard of diabetes? Diabetes.
Diabetes.
Have you heard of diabetes?
I'm not.
You've never heard of diabetes?
No.
Maladie sucre?
No, I'm not.
Ou pas kon personne qui fait diabète, maladie sucre, qui gagne trop sucre?
Oh.
Yeah, I know someone.
Oh.
J'ai tout pas, j'entendais gagne maladie.
Yes,
Yeah, diabetes.
Yeah.
Okay.
Yeah.
So it's an endocrine problem. Okay.
Okay.
All right. It's when the sugar metabolism is wrong.
Yeah, disorder.
Okay, you call that diabetes.
Yeah.
Okay, diabetes, sucre, moun nan fait sucre. Okay. Okay.
Okay.
All right. So, and you know that a maladie sucre, diabetes, it happens slowly. Okay?
Okay.
It's not like stroke. If you have a stroke, it's immediate. You have a stroke within a few minutes, munapa,
move.
Munaka mourir. Okay? So the central nervous system issues are sometimes fast. Okay? Si someone fait crise, okay? La commence à se tout coller. Okay, that's a nervous system problem. Okay? But endocrine problems are slow.
I cannot believe we're having 5 more samples.
Okay, Steve. That's probably you. That's probably you. That's no, it's probably coming from you. Okay, let's see. Let me see. There's some things for the endocrine system. Okay. Okay, I'm still sharing my screen, right?
Yeah. Yes.
Okay, well, let's see.
I remember when I first heard the word hormones. I was a little kid, had no idea what it meant, but I recall the word when someone made a phrase, it's just hormones. But then over the years, the word hormones came up a lot more, and it became clear to me, whatever these hormones are, they must be pretty important because they're mentioned for a lot of different things. And indeed, today I can tell you that yes, hormones are a very big deal, as well as the system that secretes them. You know what system I'm talking about. The endocrine system. The endocrine system consists of structures that secrete hormones. That could be at the cellular level or the organ level, but a big focus for the system and for this video is on glands. Now, some of the major glands in the endocrine system also have non-endocrine duties that we won't be going into, and some of these glands are also classified as...
Let's try another one. Endocrine system. Well, let's try this one.
Hello, friends. Today we'll learn about the endocrine system. The endocrine system, also referred to as hormone systems, is a network of glands in your body that make the hormones that help cells talk to each other. They're responsible for almost every cell, organ, and function in your body. Did you ever ask yourself, why when you dance you feel so good? Well, it's because your brain is actually creating dopamine hormone. Hormones affect nearly every process in your body, including metabolism, growth and development, emotions and mood, fertility and related functions, sleep and blood pressure. The endocrine system is made up of organs called glands. You have glands all over your body, including your brain.
Okay, so these are all the glands that produce hormones.
Mm-hmm.
The gland produced here is called insulin. Okay, gende lemon fait a diabète. You can prend piquer insuline.
Okay. Régulariser taux insuline dans sang.
Pardon?
Puis qui ça régulariser quantité insuline qu'a produit dans.
Oui. So c'est là ou pas gain quantité assez insuline, c'est ça qui bail et diabète. Okay, so these are the this is the ovary. The ovary is also, and these are the testicles. They are also endocrine glands. Okay.
Yeah.
The testicles produce testosterone. That's what causes men when you get into puberty. C'est ça qui fait croissance.
Yeah.
Okay. C'est ça qui fait garçon pousser plume en bas des selles, partie ligne. C'est ça qui fait filles former tété. Okay. So estrogen. Okay, so that's what fills out the female hips. Okay, so this deposit of fat in the hips, okay, is caused by estrogen. Okay, c'est ça qui fait voir garçon changer. Okay, testosterone. Okay, gain thyroid. Okay, that's a thyroid. Okay, puis gain un pile gland qui produit hormone dans le cerveau, okay?
Neck, stomach, and other organs. Let's have a look at the main glands that produce hormones. Hypothalamus. It's located in your brain.
Remember, we saw the hypothalamus when we're looking at the brain. Okay? The midbrain. Remember midbrain, we had the cerebellum, diencephalon, midbrain, pons,
And
medulla,
middle,
medulla oblongata. Okay. And the midbrain, we talked about the thalamus and hypothalamus. Remember?
Yes.
And controls your endocrine system. It uses information from your nervous system to determine when to tell other glands to produce hormones. It controls your mood, hunger and thirst, sleep patterns, etc. Pituitary. Located at the base of your brain, this tiny gland makes hormones that control several other glands, such as the thyroid gland, adrenal glands, ovaries, and testicles. The pituitary gland, also known as the master gland, is in charge of body growth and metabolism. Pineal. The smallest gland is the pineal gland, which balances the rhythm of the body and secretes melatonin hormone. It is also called third eye because its primary function is letting in light and darkness, just as your two eyes do. It sends signals that make someone feel tired, sleepy, wake up, and feel alert. Thyroid. It's not a butterfly, buddy. Look closely. Your thyroid is a butterfly-shaped gland in the front of your neck. It's responsible for your metabolism, heart rate, and body temperature. Parathyroid. These four tiny glands control the regulation of calcium levels in the blood. Thymus. This gland helps train the white blood cells that protect your immune system. Also, hormones released by the thymus inhibit the aging process. Adrenal. You have two adrenal glands, one on top of each kidney. They control your blood pressure, body development, and stress response. Kidney. The kidney is traditionally regarded as an exocrine gland, producing urine to regulate body fluid volumes and composition, and to excrete nitrogenous wastes. Pancreas. It is the largest gland and it performs two main functions. Exocrine function produces enzymes that help with digestion. Endocrine function sends out hormones that control the amount of sugar in your bloodstream. Ovaries. Women have two ovaries in their lower abdomen, one on either side. The ovaries release sex hormones called estrogen, progesterone, and testosterone. Testes. In men, the testes make sperm and release the hormone testosterone. This hormone affects sperm production and muscle strength. Sometimes glands produce too much or not enough of a hormone. This imbalance can cause health problems. You should exercise, eat right, and see your healthcare provider regularly. Managing these conditions can help you avoid a hormone imbalance that can lead to health problems. Here's the diagram. Hypothalamus, pituitary, pineal, thyroid, parathyroid, thymus, adrenal, kidney, pancreas, ovaries, testes. You can use this for your studies. Now you know a lot about the endocrine system. Stay tuned for more videos. Bye-bye.
All right, I'm going to put this in our notes. Sorry, let me stop that.
Don't worry.
That's interesting. I'll put this one as well. Let me put the other one first. So you can look at this video here. You get the link. Okay. Let me also put that, what we just saw. Now, it's interesting. I haven't seen it before. Types of hormones. What are hormones? Feedback. Mm.
I never either.
Okay, so let me put that on video. And you can look at that. So so now you have a general idea what the endocrine system is, right?
Yes.
Okay, so several glands all over the body produce hormones, and these hormones, regulate our body growth. You saw all the things: your sleeping, your eating, your mood. They're all controlled by hormones. Okay. So I won't go into well, let's see this one. Let's see what this one is. Copy hyperlink. Let's see what that hyperlink is. Okay, well, let's see this.
The endocrine system is one of the two systems that are responsible for communication and integration between various body tissues, the other being the nervous system. Endocrine communication is achieved by means of chemical messengers called hormones. Hormones are produced in endocrine glands and secreted into the bloodstream to reach body tissues. A hormone can travel wherever the blood goes, but it can only affect cells that have receptors for it. These are called target cells. There are two major types of hormones: steroid hormones derived from cholesterol and are lipid-soluble, and non-steroid hormones derived from peptides or amino acids and are water-soluble. Lipid-soluble steroid hormones can cross the cell membrane to bind to their receptors inside the cells, either in the cytoplasm or nucleus. Steroid hormone receptors are typically transcription factors. Upon forming, the hormone receptor complex binds to specific DNA sequences to regulate gene expression, and thus mediating cellular response. On the other hand, water-soluble non-steroid hormones are unable to cross the lipid membrane and therefore must bind to receptors located on the surface of the cell. The binding triggers a cascade of events that leads to production of CAMP, a second messenger that is responsible for cellular response to hormone. It does so by changing enzyme activity or ion channel permeability. Major endocrine glands include the hypothalamus, pituitary gland, pineal gland, thyroid and parathyroid glands, thymus, adrenal gland, islets of the pancreas, and testes in men or ovaries in women. The endocrine system also includes hormone-secreting cells from other organs, such as kidneys and intestines. Except for the hypothalamus and the pituitary, different endocrine glands are involved in different, more or less independent processes. For example, the pancreas produces insulin and glucagon that keep blood sugar levels in check. The parathyroid glands produce hormones that regulate calcium and phosphorus. Thyroid hormones control metabolic rates, while the ovaries and testes are involved in reproductive functions. On the other hand, the hypothalamus and pituitary gland play a more central, integrative role. The hypothalamus is also part of the brain. It secretes several hormones called neurohormones, which control the production of other hormones by the pituitary. Thus, the hypothalamus links the nervous system to the endocrine system. The pituitary is known as the master gland because it controls the functions of many other endocrine glands. A major role of the endocrine system is to maintain the body's stable internal conditions, or homeostasis, such as blood sugar levels or serum calcium levels. To do this, it utilizes negative feedback mechanisms, which work very much like a thermostat. The heater is on when the temperature is low, off when it's high. For example, when blood glucose level is high, such as after a meal, glucose induces insulin release from the pancreas. Insulin helps body cells consume glucose, clearing it from the blood. Low blood glucose can no longer act on the pancreas, which now stops releasing insulin. Another example is the regulation of thyroid hormone levels, which are induced by a pituitary hormone called thyroid stimulating hormone, TSH. TSH, in turn, is under control of thyrotropin releasing hormone, TRH, from the hypothalamus. When thyroid hormone levels are too high, they suppress the secretion of TSH and TRH, consequently inhibiting their own production. Thank you for watching. If you like our videos, be sure to check out our new Patreon page. Patreon is a simple way.
Let's see.
So the way, what they were describing as to something causes the secretion of something and then slows down the secretion of the other, that is called negative feedback. Okay? Negative feedback. All right? So all the glands, how they're called endocrine glands. Okay? They secrete directly into the blood. Okay, so what are hormones? Hormones are chemical messengers. And there are different types of hormones. There are peptide hormones, steroid hormones, and amine hormones. Okay. Hormones travel through the bloodstream and bind to specific receptors on the target cells, triggering specific responses. So this is talking about feedback. Okay. So like you have your thermostat. When your temperature is low, right? Your thermostat causes your heater, to start working. And your temperature keeps going up, 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 up. When it reaches the set temperature, it turns off your heater so that your heater doesn't keep producing heat. So we'll call that negative feedback. Okay?
Okay.
So that's how the system works. Okay? So there's a lot of what I'm going to do is I'm going to leave you to go back to read. There's a lot here. Okay? So read. So I remember the last time I said that we should send recording of the introduction. Jethro, did you ever send
the introduction?
Yeah, did you send me a recording?
Yes, I do.
Stanley, did you send?
No.
Why not?
I forget about that.
I know I got it from Steve. I mean, it's something which I said and I repeated several times. All you needed to do was look at that thing, record it, and send it.
Yeah.
I mean, that was all you needed to do. Okay. We will stop here. You can go ahead and read the rest of this material. I'm going to send it to you, and then we'll complete it next week. Okay.
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 And there will be a quiz. Actually, there will be a quiz on this during the week. Okay. There'll be a quiz on the endocrine and nervous system during the week. All right.
During the week.
Yes,
Oh.
there'll be a quiz. I will send you a quiz.
Okay.
All right. Okay. So I will send these to you now. All right. So we'll end here, and I have a meeting at 7 p.m.
Okay.
Okay. All right then.
All right.
Okay. Bye.
Bye.